Hello, my name is Jorge Cortez from the Department of Leukemia at MD Anderson Cancer Center in Houston. There has been a lot of progress in the management of patients with chronic myeloid leukemia with the introduction of the tyrosine kinase inhibitors. Since we started using these agents, we have seen a dramatic improvement in the life expectancy of the patients with this disease. And we know now that the majority of patients can have a normal life expectancy, the life expectancy that is what you would see in individuals of the same age and the same sex and other characteristics. However, to be able to achieve that, it is very important to be able to properly assess the patients from the beginning, address their comorbidities, identify the proper treatment for each patient, mark our goals so that we know what kind of responses we want to achieve at what time points. And with that, try to decide when is the right time to consider a change. What is the right treatment for each patient? What are the characteristics? What are the data with the different treatment options that we have as initial therapy and then as subsequent therapy? We have the fortune to have many tyrosine kinase inhibitors. We have 5 approved, and even other drugs that are not tyrosine kinase inhibitors. And what is the role of transplant in some of these patients? To do that, we need to properly monitor the patients, do the right tests at the right time, know how to interpret, know what kind of responses are expected at what times, and how to look for additional issues. For example, when to assess for mutations. All of these can lead to very, very good outcomes for the patients. But again, it is very important that we offer the best care to the patients so that we can achieve those endpoints. So through a series of different modules, we're going to be reviewing all of these features to try to integrate them into the proper treatment of the patients. Another important element of the management of patients with CML today is that we're starting to consider what we call TFR, treatment-free remission. That means that in some patients we know there may be a possibility of stopping treatment with a tyrosine kinase inhibitor. But it is very important that we know when to do it, how to do it, who are the right patients to consider, and what do you do when you stop the treatment so that you minimize the risks for the patients in case they are going to relapse. What are the challenges that these patients face from symptoms and their concerns, etc. So these features require very close attention and deep knowledge of what we are doing so that we don't transform a good situation of the patient into a potential risk for these patients. We also have some new information about the management of children and adolescent and young adults. And this patient population is not that common, but we're increasingly seeing these younger patients. So to understand what are the challenges, what is the data for the patients with this disease in this age group, that becomes very important. That is also going to be addressed in some of the modules that we're going to have in this program. So I think that for these small modules that each one of them focus on a specific aspect of the management of chronic myeloid leukemia, we will do a comprehensive overview of what we know today, the challenges for the future, and the proper management of patients so that we try to help provide this optimal care that will give the patients the best probability of having the best possible outcome and that they can reach that normal life expectancy that we know is possible when we do the right things for these patients. So I hope you enjoy this program. I think we have a fantastic lineup of speakers, all of them experts in this field who have done a lot of research, have treated a lot of patients, and who can tell us what their experiences are, what the data is, and put it into the context that can help your patients and you manage as well as possible. So please enjoy the program, and I hope this information will be of value to you.